5,
5,
6,
6,
7,
7,
8,
8,
9,
9,
10.
10.
And put those over here next. So the circulator marks that off. Write down 10.
Laps.
Laps. When we're counting laps, we always pull on the string, make sure that doesn't come out. 1,
1,
2,
2,
3,
3,
4,
4,
and 5.
5. Bogey tip.
Bogey tip. 1.
1.
Make sure she sees that.
Scratch pad.
Scratch pad. 1.
1. Kitteners.
Kitteners. I'm gonna need some kitteners, please.
Go to Sea Locker.
Make a note of that.
Write down what you have to pop up.
It's all on camera.
Check your expiration date, routine, make sure there's no tears. Pictures.
Kitteners. I have 1,
1,
2,
2,
3,
3,
4,
4,
5.
5. Blades.
Wait, I don't have any blade yet.
Oh. Circulator. Oh, sorry.
You guys practice this yet?
Never.
Make sure you pay attention. This is how you have to do it. You have to do it.
Check for expiration date, and still no tears.
Make sure that you get a needle driver. You support your wrist, one underneath the other. She'll fill it halfway down. You flip down on it, actually ratchet it, say, I got it, and then she will pull the rest of it off. So just pull it apart. Apart. There you go. That way you don't accidentally puncture the packaging. If you puncture the packaging, what happens to that knife blade? Alright, then go ahead and put in your sharp spots.
Suture.
I don't have any suture either. So give me a packaging.
A Vicryl.
And I need 3 ties as well.
Are they supposed to be in there?
No, it's a pop-up.
Oh, I'm going outside to get the
Alright, while they're doing that,
So these will.
you're going to get your number 3 knife flip handle. Number 3 knife handle. Your, kind of grasp it like this at the tip of it. Hold it down. Look for the number. The number should be on top. The number on the blade should be on top. Everybody see that?
Yes.
Okay, there's a little ridge on your knife handle. That's where the hole is going to go. Make sense?
Yes.
Kind of, something like that. Alright, take your fingers out of the rings. That way it's easier to handle, especially when you're first doing that. And slip it on. Hear it click. Let it go. You want to make sure it's down. Just like that. And put it in your kitchen basin. That's where it stays. Okay. Well, make sure that you get to practice this with an instructor. You should not be practicing this on your own. I don't want any cut fingers, cut off fingers. Nice.
checking for expiration date, validity, integrity of packaging, and no tears.
Alright, so we got the suture, right? How did she know what suture to get?
The color.
Because it's written on there.
You know, how does she know what kind to get? What color, what size?
Depends on the procedure.
Because it was written on the paper.
What paper?
The count.
The count sheet.
No, it's not right on the count sheet.
Very good.
Surgeon's preference card, so make sure you're taking a look at this, okay? Let you know what suture you
Where
need to
did
get.
that come from?
Oh,
Oh,
God.
I'm sorry, but everyone knows me.
Oh,
And these are three ties. Do we count three ties?
yeah.
Yes.
No.
Suture.
No, go ahead.
Oh, we don't?
We
Doesn't
don't count
have
three
a
ties.
social.
No.
It's just the ties, just a piece of string.
It's just a
So
tie.
that'd be a lot of counting.
So if I say sutures,
What the heck?
So we're doing suture, right? Suture. One.
one,
Make sure the circulator sees the needle. And so this closed packet, I have to open it. And two.
two. Traumatic towel clamp,
Okay, before we move on to instruments, I also have a hypodermic needle. Please add that. One hypodermic needle.
What would you use that for?
For local injections, for a case start.
traumatic towel clamp,
Traumatic towel clamp. One,
one,
two,
two,
three,
three,
four.
four. Kelly curve,
Belly curve. One,
one,
two,
two,
three,
three,
four.
four. Kelly straight,
Belly straight. One,
one,
two.
two. Peon,
Peon. One,
one,
two,
two,
three,
three,
four.
four. Poker,
Poker. See, this is why these sets have to be set up properly. Make it easier to count. Coker. One,
one,
two.
two. Alice,
Alice. One,
one,
two,
two,
three,
three,
four.
four. Babcock,
Babcock. One,
one,
two.
two. Right angle,
Right angle. One,
one,
two.
two. Needle holder,
Needle holder. One,
one,
two,
two,
three.
three. Sponge forceps,
Sponge forceps. One,
one,
two.
two. Medicine ball,
Medicine bombs. One.
one. Mayo,
Mayo tissue. One.
one. Mayo suture,
Mayo suture. One.
one. Number 7 knife handle,
Number 7 knife handle. One.
one. Number 3 knife handle,
Number 3 knife handle. One, two.
one, two. Tissue rat tooth forceps,
Tissue rat tooth forceps. One,
one,
two.
two. Dressing plane forceps,
Dressing plane forceps. One,
one,
two.
two. Adson forceps,
Adson forceps. One,
one,
two.
two. DeBakey forceps,
The baking forceps. One,
one,
two.
two. Army Navy retractor,
Army Navy retractor. One,
one,
two.
two. Weightlander retractor,
Weightlander retractor. One.
one. Richardson retractor,
Richardson retractor. One,
one,
two.
two. Full suction,
Full suction with guard. One.
one. Yanker tonsil suction,
Anchor tonsil suction. One with tip.
one. It's complete. Count.
Count is complete. So you want to knock your count out first. That way, what does the circulator have to do now? What's your last lesson?
Notify the
What?
prep.
Skin prep, right?
Skin prep.
Very good.
How about the mail stand?
All right, now we're going to make our surgeon's present. What went into that? Everybody remember? The surgeon's present, the bucket of junk.
The light handles?
Light handle.
Oh, okay.
Bovie and scratch pad.
Some free time?
Can't count.
Staples?
What is that green thing?
Like,
HM1.
Suction tubing?
These are
What is that?
light handles.
Oh, light
Kind of
handles.
push them out. There you go. All right, there you just flip them on.
Okay.